What is laparoscopy for fertility? Surgical treatment. Imagine being able to look inside your abdomen without large cuts or long hospital stays. That's what laparoscopy offers for women facing fertility challenges. It's a minimally invasive surgery that helps doctors see and fix problems in the reproductive organs. During the procedure, a tiny camera called a laparoscope is inserted through small incisions in the abdomen. The surgeon inflates the belly with a small amount of carbon dioxide gas to create space for a clear view. Through the camera, they can examine the uterus, fallopian tubes, and ovaries directly. Laparoscopy is especially useful for diagnosing issues that might not show up on imaging tests. For example, it can identify endometriosis, which is a condition where tissue similar to the uterine lining grows outside the uterus. Endometriosis can cause scar tissue and inflammation that block or distort reproductive organs, making conception harder. The procedure can also reveal blocked fallopian tubes, pelvic adhesions or scar tissue from previous infections or surgeries, fibroids that distort the uterine cavity, ovarian cysts, or abnormal uterine shapes. One of the key advantages of laparoscopy is that it allows for treatment during the same operation. If endometriosis lesions are found, they can be removed. Adhesions can be cut to free up organs. Fibroids can be excised or reduced. Damaged or blocked fallopian tubes can sometimes be repaired. To check if the fallopian tubes are open, the surgeon may perform dye testing by injecting a blue dye through the cervix into the uterus. If the tubes are blocked, this can be addressed during the same surgery, improving the chances of natural conception. Laparoscopy is often performed under general anesthesia and usually takes between 1 and 3 hours. It is typically an outpatient procedure, meaning women can go home the same day. Recovery is generally quick, with many women returning to normal activities within a few days. However, like any surgery, it carries some risks such as bleeding, infection, or accidental injury to organs. That's why it's important to have the procedure done by an experienced reproductive specialist who can carefully evaluate whether laparoscopy is suitable for your specific situation. For women with endometriosis, laparoscopy is considered the gold standard for both diagnosis and treatment. Removing endometrial tissue and adhesions can restore normal pelvic anatomy and significantly improve fertility prospects. It also allows doctors to assess other potential causes of infertility in one procedure. While it is a safe and effective option, it's essential to remember that individual results vary and your healthcare provider can help determine if this surgery is right for you. Always seek personalized advice from a qualified medical professional to explore the best options for your fertility journey.